seizure. She was 18 months old. It was Christmas Eve. I will never forget that day the rest of my life.
I was 10 years old, and I woke up in the middle of the night, and I wasn't able to sleep. So I went into my mom's room, and I asked if I could sleep with her. And the next thing I remember is waking up on the floor.
This is a story of two women with a condition that an estimated 2.5 million people have in the United States alone. Yet most people are unaware. This is The Quiet Storm. This 3-part series was written, produced, and directed by Holly Bernard, and I'm Amanda King. Holly, age 27, and Ashley, age 26, both have a neurological illness called epilepsy. Dr. Anton Bajic is the chief of the epilepsy division of the University of Pittsburgh Medical Center. He explains the condition.
Epilepsy is not really a single disease. It's a group of disorders that are characterized by spontaneous, unprovoked seizures as their symptoms. A seizure is a symptom of diseases that we call epilepsies. An ancient definition that I usually use when I teach, and it basically defines epilepsy as an illness of various shapes and horrible.
Ashley's mom, Tracy, speaking on her daughter's behalf, says that Ashley received an official diagnosis of epilepsy when she was 14 years old. But long before that official diagnosis, she experienced her first seizure.
My daughter had her first grand mal seizure. She was 18 months old. It was Christmas Eve. I will never forget that day the rest of my life. My daughter was playing. Everything was fine. I heard a thud. I jumped, and so did everybody else, and we ran in, and there's my daughter laying on the floor having a grand mal seizure.
Holly's first seizure was also unexpected and occurred a few years before getting her official diagnosis at age 10.
1 to 2 years before getting the official diagnosis, I didn't know what to call them, but I found out that they were staring seizures, where I would look perfectly normal to anyone else, but just like in my mind, it was just this really scary experience. It's kind of hard to describe, but everything looked different. It's like a quiet storm because there's a lot of stuff going on. But from the outside, I look perfectly fine.
Holly says that while the staring seizure, which is often mischaracterized as an absent seizure, occurred while she was aware of her surroundings, but was unable to communicate effectively. One time, a seizure occurred when she was with a friend and was informed after the fact that she had spoken a different language while the seizure was going on.
I had one, and I looked perfectly fine, but she's like, I didn't understand what you were speaking. You were speaking a different language.
When Ashley was undergoing testing for epilepsy as a teenager, it was discovered that she had staring seizures for many years without knowing what they were. Much like Holly and Tracy says, that it made sense that Ashley had them because her behavior at home and at school was sometimes very uncharacteristic. Tracy would get calls from Ashley's school saying she was unattentive, which had not always been the case for the straight-A student.
I would get calls from the teacher that would say, you know, she's such an intelligent child, but she doesn't pay attention in class. She's always staring off into space. When I try to talk to her, she just totally ignores me. And I said, this is not my daughter.
The seizures that Holly and Ashley experienced prior to their official diagnosis are only 2 of the many symptoms of epilepsy that can occur, Dr. Bajic says.
Some people stare, some people twitch, some people jerk, some people pass out, some people convulse. Person may start talking uncontrollably, person may stop talking, and I can go on and on.
Tracy used the term grand mal to describe Ashley's first seizure. This term, along with petit mal, are 2 types of seizures most people are familiar with. In general, the term grand mal is usually associated with the stereotypical seizure of convulsions, whereas petit mal is often associated with staring. However, there are several other types of seizures, because much like other medical conditions, epilepsy is not black and white, and it is possible for one person to have multiple types of seizures. Seizures are divided into 2 categories, focal and generalized. Focal seizures originate on one side of the brain.
INTEA's latest classification involves focal seizures that start on one side of the brain or generalized seizures that start on both sides of the brain. And whenever we think of generalized, we literally sometimes mean that when you look at EEG, meaning recording of brain activity, you see it's going on at the same time or literally everywhere. But one shouldn't probably rigidly just perceive it like that. So Those are two main categories of seizures. Now, focal seizures basically are further subdivided clinically. We have focal seizures without alteration of awareness, what were called in old terminology simple partial seizure. Okay. So we have focal seizures with alteration of awareness. Those are people who may fumble, may chew, may stare, and they lose track of time.
Sure.
Those are in jargon called staring seizures, and people call them frequently, in old terminology, complex partial seizures.
And generalized seizures originate on both sides of the brain.
The other end are generalized seizures. Now, generalized seizures can have different manifestations. For instance, if a person has a simple what's called absence seizure, those are usually seizures that notoriously, not only, but notoriously affect little kids. And let's say little Johnny is playing little league and he catches a ball, right? And goes like this for a moment or two, and everybody is like, throw, and then he starts throwing without realizing that there was this brief interruption in his behavior, okay? For instance, that is type of generalized seizure. So it doesn't mean that everybody who has generalized epilepsy necessarily shakes. And then, of course, there are what we call myoclonic seizures when a person jerks like this, okay? Those are so brief that it is very actually hard to establish if there is alteration of awareness. You know, because person may be sitting or playing games or something, and they just jerk like this. That's a seizure, and we know exactly what it correlates to when we do an EEG. And then, person can have tonic seizure when they stiffen suddenly and may fall. Okay? They may have clonic seizure when they just convulse, or they have combination of both, and that is notorious grand mal seizures. When people can have, stiffening followed by shaking, or vice versa.
Dr. Baujic says it is also important to know that a seizure can start as focal, but progress into generalized.